This portion of Empowered Health brought to you by the British Columbia Chiropractic Association. Your back affects your daily health. Welcome to another installment of Your Spine, Your Health.
Welcome to Your Spine. I'm Dr. Dave, and this show is all about your spine and your health. On last week's show, we talked about T6 and its neighbor T5 and T7. On today's show, we're going to go one segment lower and talk about T7 and how it relates to T6 and the one below it, T8. One condition that affects this area of your spine is osteoporosis. And the question is, what is osteoporosis? It's been called the silent thief because it causes bone loss without symptoms. It's also been called a pediatric disease with geriatric consequences. It literally means porous bones, which causes low bone density and increases your risk of fracture. So who gets osteoporosis? Well, the statistics are quite alarming. 1 in 3 women will get osteoporosis, and 1 in 5 men will get osteoporosis. How do they occur, and what part of the body is most commonly fractured? Well, first most common spot is the wrist. Wrist fractures occur from falls. The second most common area is the spine, around the T7, T8, T9, T10, and T11 regions. And this area of the spine can get injured from bending and lifting as well as from falling. And the third most common area is the hip. Statistics on hip fractures are especially disturbing. 80% of all hip fractures are related to osteoporosis. 50% of those will result in disability, and 20% will result in death within 1 year. So who's at risk for developing osteoporosis? Well, both men and women are at risk, with women slightly more at risk than men. Age over 65 years old, if you suffer from early menopause, or if your present weight is 10% lower than your weight was at age 25. Smokers have increased risk of osteoporosis, excessive alcohol intake, a poor diet, a sedentary lifestyle, and certain medications can also contribute to the development of osteoporosis. Your family history is important, and of course, low body weight puts you at risk as well to develop osteoporosis. There are many ways to find out whether you have osteoporosis, and these tests are usually bone density testing, and some blood tests will do it. So, how do you prevent osteoporosis? Well, number 1, get adequate calcium and adequate vitamin D. Eat a diet rich in fruits and vegetables and cut down on animal products that may make your body more acidic. Get some weight-bearing exercises from your family chiropractor, and encourage your kids to build up their bone mass before the age of 20 by having them eat whole nutritious foods with good calcium and good vitamin D content, and get your kids to exercise. Remember, your back is important to your daily health, and join me on the next show as we continue our journey down your spine.